Health officials are talking of this as the most alarming rise in coronavirus cases in any country at any point during this pandemic. As recently as March, as we heard, the Indian Health Minister was talking about that COVID endgame. But the number of new cases has risen dramatically since then, from around 10,000 a day to around 300,000 a day. Of course, the number of deaths takes a couple of weeks to catch up, but we're already seeing more than 2,000 deaths a day. And those who've analysed the number of daily cremations taking place suggest the number is many times higher.
It is indeed very worrying, epidemiologically speaking. It is also distressing for families who seek high-end medical care and often have quite a bit of difficulty accessing it. As far as the surge goes, as one headlines put it, it's more of a tsunami than a surge.
We'll talk about why it's happening in a minute, but first, where is it happening? Well, it's not a uniform picture across the country. On this map, the darker areas are the worst affected. And as you can see, states in the south, like Kerala and Goa, have been badly affected, but it is Maharashtra that has the highest number of cases. In the north too, Punjab and Jammu and Kashmir have been badly affected, but it is Delhi that has emerged as a real epicenter for the pandemic, with almost 100,000 active cases in the city as we speak. So what's going on? Well, COVID variants are certainly a factor, not necessarily variants that are more deadly, but ones that are more infectious. But there's also what's happening socially in India. Government officials blame individuals for being too lax in following advice, but there's also been a serious lack of government regulation, particularly when it comes to religious gatherings like the Kumbh Mela that attracted millions of Hindu pilgrims, where hundreds tested positive, and also political gatherings with huge rallies still taking place almost daily because of state elections happening in West Bengal. But India is a vaccine producer and seemed to do well at the start of the rollout. More than 111 million people have already received one dose, but that is only around 8% of the population. And look at the number of people being vaccinated in a day, and it's actually come down. And that's partly because some are now worried about leaving their homes, but also because of disruptions in some of the supply chains in some states. Of course, until this surge is overcome, it could affect us all, because the greater the spread, the greater the chance of a variant developing which vaccines are less effective against. But in the short term, this is about an urgent, devastating crisis facing hundreds of thousands of Indian families each day.
Alim Makbul. And we'll be speaking in a moment to a leading member of India's ruling BJP party. First, the Indian Diaspora is counted at more than 30 million, and 1.5 million of that number are here in Britain. Many families still have relatives in India and are watching on helplessly as the country that has ambitions to be a world superpower is proving unable to cope with the second wave of the pandemic. Here's Seema Kotecha.
Much of Britain's vast South Asian population originates from India. For many, there remain strong family links. So the seismic explosion of coronavirus cases over there is causing great concern and panic over here.
Hi, Mom.
Hello, Sonu. All right, Chotu?
You're right.
Ranjan's daughter lives just outside Delhi, along with her 2 children and husband.
I'm like paranoid and keep phoning them and saying, don't leave the house, don't leave the house, don't do this, yeah. But, you know, fair enough, they may not do it, but there's other family out there as well, you know, in Gujarat and my other, you know, cousins and things like that, and they're in the villages and stuff like that, and they also they're not in the same environments. Every environment in India is different, isn't it?
The COVID backdrop makes her daughter often feel scared and lonely.
We are doing everything we can to protect ourselves and build our immunity against it, I suppose. It is very isolated. I do miss my family heaps, and vice versa, they're missing us.
The second wave of the virus is ferocious. crematoriums don't have the space to cope with the high number of dead, so waste ground is being used to burn bodies. A nationwide oxygen shortage meant scores of patients dying in the western state of Maharashtra yesterday after their ventilators shut down. Locals are alarmed and bewildered.
It's pretty bad. The sad thing is that we are running short of medication. We are running short of hospital beds. We are running short of ventilators. So that's what it is right now. Few family members are at a very critical stage right now. In fact, one of them is getting admitted in a hospital in Delhi. It was not easy getting a bed for one of our relatives, and it's just that's what the situation is. We're not safe.
Some are blaming the government. Religious festivals and other large public gatherings have been allowed to continue, attracting millions.
We have to be very careful about, we knew that at least for the next 2 years, we have to, maintain a little bit of distance. But yeah, the government could have done a lot better. They could have seen this coming, and they could have avoided certain gatherings.
India has been manufacturing the AstraZeneca vaccine, supplying countries across the world. This week, COVAX, the group assigned with distributing vaccines to poorer nations, said it will reduce the number of doses sent to other places after India stopped exporting them to help at home. Some believe Britain needs to step up its international support.
Well, the UK government can do a lot more than it currently has. Firstly, it has talked about the surplus vaccines that we will have. What it hasn't done is actually state how many surplus vaccines we are likely to have and what is the timeline of us being able to give those either back to the COVAX facility or have bilateral agreements with places like India, for example. Clearly, the government hasn't just given any detail.
A Number 10 spokesperson said there had been no request for help from India, but that it would consider any request very closely, as you would expect. From 4 a.m, India will be put on the red list, so most people who have travelled from there will be refused entry to the UK. For those here who call it their motherland, India's crisis is theirs too.
What does India mean to you as someone of Indian descent?
India means home. My heritage, my culture, everything is from India. My children grew up with that as well. So I feel deeply about people and the situation out there, but at the same time feel helpless. What can we do from here?
Seema Kotecha. Well, a short while ago, I spoke to Vijay Chautawale. He's a member of Indian PM Narendra Modi's BJP party and the head of the party's Foreign Affairs Department. I asked him why India's health minister declared the country was in the end game of the pandemic, when that clearly wasn't true.
But government has never said that you need not follow the social distancing or stop using the mask. They have always cautioned that there is a threat still around. But what has happened in India, that as the restrictions have gone down, the communication started, the people started moving in the public transport, which is the major mean of communication in India. And that's one of the reasons why the cases have gone up again.
But when you look around the world and you saw what happened when people came out of lockdown or didn't take sufficient measures, why didn't, in this hiatus, as it turned out to be, you plan to make sure that you had enough oxygen, you had enough medical supplies, you had enough hospital beds, you had enough ventilators?
There is a little bit mismatch of oxygen between supply and demand, but now the private industries who have producing oxygen in large amount for their own consumptions have come out and they are supplying it for the medical purposes. And actually the oxygen demand, oxygen supply will surpass the demand at a national level.
In the next few days, oxygen supply will surpass the demand, and we saw an oxygen carrier blow up, and there was no oxygen for the patients in that hospital.
Absolutely. There was some tragic incidents, and it's one of its kind. but it's not a norm, it's an exception, it is a highly exception.
So the stories of people that can't get any kind of treatment, that can't get access to proper PPE themselves, that can't get tests, they're not widespread. They're just one-offs.
They are one-offs, yes.
But you're facing more than 300,000 cases a day, a shortage of oxygen in Delhi, and doctors on social media begging for medical supplies. It is a situation that is actually now out of control.
It is not out of control, it is serious. There was a situation even in England that similar situation happened. So every country, big country has gone through it. India is not an exception. Of course, that is not an excuse. So Indian government is trying its best.
But if you're suggesting that the crisis is being reduced, we see people standing, not social distancing, without masks, waiting for treatment. Why is India not actually in lockdown?
No, lockdown, we did it once at the beginning of the crisis last year. But now the measures, because in the vast country like India, there cannot be a uniform policy. Even in the small, geographically small country like UK, the Scotland is following different policy than England. So it is being done at a state level, and some states have announced lockdown. Some states where the crisis is not that severe, they have still allowed the movement of people.
But why are there political rallies? Why are there still religious gatherings? Why are they going on? And why are there state elections in West Bengal right now when the scientist has dubbed the triple mutation found in India, the Bengal strain, as one of the most potent and ineffective against vaccine? Why not stop all political activity?
You are talking more like a politician than a reporter, but give me a data to show that these political gatherings are resulting into a pandemic where cases are high, have nothing to do with the religious gathering or with the political gatherings.
My point is, social distancing is not taking place at big religious gatherings and big political gatherings. These are the main gatherings.
No, you should understand the complexity of the country like India. These gatherings are taking place not for last few years, but for last several centuries. And people are coming there at a particular time point of the year, every 12 years. And they are celebrating.
Why is India not able to roll out an effective vaccine program? You've done it in the past.
In last 90 days or so, since we have rolled a vaccine, Indian government has committed that we will give at least one dose of vaccine to 300 million people by August. And we are very much on it. The capacities of the vaccine manufacturers are being enhanced. Similarly, the Russian vaccine Sputnik, which is already approved in India, they are going to give more than 500 million doses in next 1 year.
You talked about the summer, you talked about a year. You don't have that time. Why? I mean, you're manufacturing huge amounts of vaccine, and a lot of it's coming to the UK from AstraZeneca. Why is this time lag? Why can you not get the vaccine out in the next 2 or 3 weeks? You will have a very large death toll if you don't vaccinate first vaccines within a year.
The AstraZeneca vaccine, which is being produced in India, that is the only significant vaccine producer in India, which has a capacity of close to 1 billion doses per year. The Sputnik is coming, and Indian government has liberalized entry of other vaccines, including Johnson & Johnson, Pfizer, and Moderna. So from June onwards, there is another indigenous vaccine that is at the phase 3, which is likely to finish its data very soon. So by June, July, Indians will have 5 or 6 vaccines on the table with ample of supply so that people can have the choice.
You are very much involved in foreign affairs of the BJP, and you speak to the diaspora. I know you organise big events all over the world, in UK, in Los Angeles, in Toronto, 30 million Indians around the world. Many of them will be looking into India, wondering if their relatives are going to survive this.
Yes, we will like to assure each one of them, Indian government, practitioners, doctors, healthcare workers, private industries, social organizations, religious organizations are doing their best to help the people who are in distress.
If you cannot get a grip of the pandemic, That will be a huge fail for Narendra Modi's government, won't it?
Yeah, and that's a big if. We are in the grip of the situation, and you will see the decline in the cases in next few weeks, and we will be close to what we have achieved in January, February this year in next few months.
So just finally, you really don't think there's a problem?
No, I am not saying. I accepted it in the very first day that there is a crisis. It's a very serious crisis. There is no denying of it, but we are not helpless. And there is a great collaboration between the society and the government, which you hardly see in other parts of the world. And that is going to be the key to control this pandemic.
Dr. Chartawali, thank you so much for joining us tonight.
Thank you very much.